Welcome and thanks for joining us. My guest today is Dr. Jennifer Garrison. She's a senior consultant at Maximus, and it's great to have you with us.
Thank you, Tom. Absolutely awesome to be here.
All right, we're going to talk about the delivery of health care to veterans and service members, a huge enterprise in the government, and also a lot of people are recipients of this health care. And so talk about the trend from one-size-fits-all approach. How are they personalizing it for better customer experience and better outcomes?
Well, Tom, we're shifting from a one-size-fits-all approach to a personalized healthcare experience impacting service members and veterans. And how we are doing that is we're using the integration of technology that has influenced military medicine to a more personalized healthcare experience for service members by really enhancing both the efficiency and effectiveness of medical care during conflicts. So the great thing about innovation is that we're using portable medical devices, advanced technologies, and those are tools that have transformed how injuries are treated on the battlefield, ultimately saving lives. Among the key advancements is telemedicine. So we've used that. So when COVID-19 happened, we're trying to make this where we get to if you can't bring the hospital to the patient, bring the patient to the hospital. So how we do that is real-time consultations to soldiers and veterans in remote locations, anytime, anywhere. This capability ensures the timely interventions. Even when healthcare providers are miles away, we're able to bring that to the front line of any military hospitals, improving treatment and outcomes. I think the good news is that additionally, advancements in medical equipment, we're able to bring drones out into the battlefield. So we're bringing blood, we're bringing automated external defibrillators for cardiac emergencies, having further streamlined emergency response efforts. And I think the impact of technology on military medicine is evolving because we can't go back to where we were at back in 1950s, where we relied on paper, where we relied on things that, just were old school. So we have to evolve our military medicine, and how we're doing that is digitizing everything. So we're able to increase operational efficiencies and bring the hospital to the patient at any time. So the broader field of medicine continues to evolve, and we're reflecting the enduring legacy of military medicine in history.
So it sounds like the integration of this infrastructure and the technology and the telecommunications to put together for this remote capability, it strikes me that medicine becomes not simply you deliver upon injury or the taking on of disease, but maybe monitoring people before they get injured or before they get sick, because this capability is in place. And therefore it's personalized because each individual is measured and evaluated ahead of time. Fair to say?
I think that's correct, because we're using AI and machine learning to be able to predict those algorithms. So we're able to predict those healthcare patient outcomes. And so with that, we're able to bring in more digital healthcare information tools at the forefront. And so we're able to work with our providers and our patients to predict, hey, this is what's going to occur, what are those trends, and how can we improve those patient outcomes. So it's wonderful that we're going through this digital stage. We just got to make sure that, comfortably, the cultural shift changes at the speed of relevance for our patients.
And by the way, is one of the technologies involved here the placing of sensors in uniforms and on the body while people are at work?
How that's actually working is when they show up, we're able to say, hey, the sensors that are located, you can use a kiosk, you can use a patient portal. We're talking about human-centered design here. What I like about that is it's focused on three things: empathy, collaboration, and ideas of innovation. And that's good because that's integrated with artificial intelligence at the same time, and how we can make connections that would be difficult or impossible for a human to make as quickly or accurately as possible. So when you combine those technologies together, it learns on its own rather than being programs, so we can ensure that the patient is seen in a more timely manner.
You mentioned empathy, and that's not a word you often hear in the military context, and I'm sure that practitioners of military medicine and of VA medicine are empathetic. We know they are. But what does that do to the culture? It sounds like a cultural element as well as a technological element here.
There is, because we see patients every day. So I have a father-in-law. He's 89 years old. We were just having this along the way. He said, look, I'm used to going in and carrying my medical records with me. And I'm like, oh, well, you should bring your telephone with you. So in case your provider asks you, hey, what happened? What's your history on labs? What's your history on immunizations? If you don't have that with you, you're able to bring that up and say, hey, here's all my medical history, so you can make that determination going forward. The providers want to have empathy for patients because they understand that they're used to a certain way of doing things. But if we can make that culture shift as quickly as possible, whether it's through training approach or giving them, guidance on how to do it, I think they'll be able to shift even further.
And this idea of human-centered design also includes a little bit of self-service. I think we're seeing this in so many domains.
Yeah.
And I wanted to ask you about this idea of portals or the secure digital front door. If those aren't designed well in a human-centered, then people get frustrated, and we've seen this in our own lives, I think, trying to access portals. But VA and again DHA, tell us about the digital front door idea and how that's aimed at helping people access on their own.
No, absolutely. So the digital front door came about a couple years back. I was actually the operational medicine director for DHA, the first one. And that was one thing that we were working with at DHA, their digital information management tool. And that proposed a solution to deliver comprehensive suite of digital capabilities, both emphasizing for the patient and the provider experience. And I like the fact that they're looking at replacing those existing systems because we have near-peer competition between China, Iran, Russia, a lot of our countries, and we have to be at the forefront when it comes to technology. So with that, we've developed a digital front door called the Area of Interest, AOI. That's called for a lot of commercial solutions to address 3 primary lines of effort: patient experience, equipping providers with supportive technologies, and enhancing data management capabilities. The good news about where I work at Maximus is postured all the time because they're focused on operational readiness, increased efficiency, and evolution and modernization in technology. So that's why I'm proud to also, I want to say that, working at Maximus, because it's a very great company that integrates very well with DHA and what they're trying to do for mission requirements.
And that data management capability, tell us more about that.
So there's a story with this. So before COVID, I was at the Defense Health Agency, and we didn't have a way to integrate all this data that was coming in. So we needed to know who got vaccinated, whether it was service members, contractors, civilians. And so we actually had to stay late at night trying to collaborate and get all this information for 451 military treatment facilities. So that's when we decided to say, okay, how can we centralize this level of technology where it's integrated so all the joint services are able to funnel that up information, and we give that information at the fingertips of our Secretary of Defense and our President of the United States. Because when he has to make a decision, those data technology management tools come into play very well because he's able to get that at the speed of relevance. He's not waiting for somebody to hand jam those numbers in. He can actually use AI machine teaming to pull that information out and have it to make decisions.
And so as sensors and doctors and instruments touch people, that data gets recorded at that moment and becomes part of this integrated kind of data management system?
Yes, it does. And so no more having health records that are in the ceilings like they used to be back in the day. So when I first came in the military, I would, no kidding, at midnight going, where are all these medical records? Nobody can find them. And so because these digital health information tools are available at the fingertips of our providers and our clinicians, it's wonderful because now they can extract that information out using predictive analytics with AI and machine teaming to be able to provide better patient care. I'm able to get you in and out of a hospital and a clinic as faster because I'm able to make those quicker decisions through clinical decision support systems.
You know, and at the practical level, provider support and patient experience are kind of flip sides of the same thing. And just to make a prosaic example, every time you say go to a different provider, they want to know, well, tell us all your prescriptions.
Correct.
Well, nobody memorizes that. So
No.
it sounds like this is the type of information that is known in the system and everybody can access it easily, and then you avoid that bad experience step.
Oh, 100%. So let me give you an example, Tom. When I was in the military and I came in, I had to carry a full medical record around with me. So when MHS Genesis came aboard, that was awesome because it has an end-to-end integrated technology that encompasses all of your healthcare needs. So, and I'll give you an example. A provider will come to me and say, do you have the history of, like I said, labs or immunizations, or, hey, what happened to that diagnosis? If I can't remember, because I have a lot of things on my mind, I'm able to bring up, whether it's on my phone, through a patient portal, and bring up that information so I can say, before you prescribe that to me, there's something that you need to know. And before you do that referral, I want to make sure that they understand my history so they're able to make informed decisions and I can receive the better care that I need.
Because you mentioned too modernization, and the implication there is that there is a constant stream from your company of technology insertion, to use the DoD word, to update things. That's part of this also. This is not a fixed, static system you're operating.
No, and I think what Maximus has done very well is not only are they focused on this modernization of technology, they are also hiring staff that does AI and machine teaming rather well. At corporate companies after I had retired, they were in the beginning stages of doing that. And it was hard because the culture shift of getting their people trained and having them to be able to do this. I think Maximus did that very well. They said, hey, not only are we going to have a chief information officer, but we're also going to have an artificial intelligence officer, and we're going to integrate those two. So one is focused on evolving and modernization, while the other one is focused on the day-to-day grind. So marrying those two up, one's able to provide those security firewalls that our artificial intelligence folks need, because everyone's worried about security, specifically when you put in those AI algorithms to predict analytics and make sure that we're using the technology correctly.
All right, on that note, we're going to take a short break. My guest today is Dr. Jennifer Garrison. She's a senior consultant at Maximus. I'm Federal Drive host Tom Temin here on Federal Insights, sponsored by Maximus at Federal News Network. Welcome back to Federal Insights, sponsored by Maximus here on Federal News Network. My guest today is Dr. Jennifer Garrison, senior consultant at Maximus. I'm your host, Tom Temin. And before the break, we were talking about a lot of pieces of technology, artificial intelligence, also hardware that is in the field and in the hospitals, all impinging on the care of the individual. I wanted to just talk for a moment about the infrastructure that supports this, the network infrastructure, the platform, because that's, I think, an important element that Maximus is pretty deeply involved with.
They are. Maximus clearly has designed a platform that can enable to go alongside MHS Genesis. So I'll talk about that first, because when you deploy a single EHR, in which MHS Genesis has done, it's a big milestone, which is great. From the minute you get into the military to the minute that you get out, you have one single record. So how are we able to filter that when we're working with companies alongside Maximus? While we're working with that, whether it's a dental, whether it's immunizations, the pharmacy network, we're able to develop that API with that subcontractor, and so it's bi-directional. So that's good, as they can filter into that platform where it's that one single source of truth. And as we work alongside the Department of Defense, we also are able to work with them as well, specifically DHA, to pull that information out. So we're all on the same page when it comes to receiving that medical information on the veterans and service members.
And exam readiness, what does that exactly mean?
So we have physical health assessments, and so that's what it is. It's an exam. So when a service member shows up, or even a veteran, we're able to look at that document and be able to say, okay, here's things that we can provide, whether it's a provider or a clinical team, but there could be something like a profile. I don't know if you know what a profile is, but a profile is where they have to get seen, maybe by another provider that, like dental treatment or something like that, that we can't provide. So it's able to be bi-directional, and so they can be able to see the same information. And
I want to also elaborate on something you've mentioned, and that is the idea of how this all relates to readiness, military readiness, which is a difficult thing to maintain for a lot of reasons. But how does the health plan and the health program and maintenance of it help readiness, just by simply keeping service members in good health, or is there more to it than that? Well,
so it's real-time live data. So what's good about this is, you've seen Star Wars, right? So you remember the little BB-8 unit that was always, that's something that we want to drive towards, because if you are in a conflict and you have systems go down and you need to focus on prolonged care, how are you going to manage that when everybody's running around and you're trying to get your patients up and running so we can not only take care of our patients, but we got to take care of the installation? Using something like this would be able to be at the fingertips of your clinicians, your anybody, not just your clinicians, but your admin team, logistics. So they're able to understand who needs morphine, when's your medical supplies going low. It's able to provide that predictive analytics and machine teaming that can help save patients' lives. It's also going into the operational triage approach. I don't know if you know what that is, but it's an awesome way to see things through a different lens. Whereas if you have to get a runway back up and running, you're not, yes, physicians are focused on the person that's critically most hurt the most, but for the greater good, we're focused on treating those patients that have the knowledge and level of expertise to get that runway back up and running so we can get in the air and defeat the bad guys.
Wow. Okay. So yeah, it really does relate directly then to
really
operations and not medical operations, but military operations.
Yes. I love the fact that President Trump signed an executive order driving military excellence and readiness at the forefront. He actually signed that on January 27th of this year, and that's what DHA is going to, and that's what Maximus wants to be alongside that to help take care of the DHA mission and medical readiness requirements.
And when you have digitized so much of medicine and enabled the capability to have it delivered remotely, that I would think there's another efficiency in that, in the sense that we tend to think of medical care delivery in both of those systems, VA and DHA, as location-based. There's these centers, and VHA has its centers, 132 of them, and DHA, I don't know how many, but a lot, all over the world. It seems that with telemedicine and the maintenance of good sources of truth in the records, that it virtualizes that delivery. You don't need the radiologist in Kansas City if they're not,
that is correct,
if they're busy, but there could be one in Guam that could do the same thing with a little bit of latency of a few seconds.
Yeah, the real-time consultations that you can do at any time, any place, anywhere, that's where the DHA has always talked about modernizing healthcare to bring the hospital to the patient. It's all about patient-centeredness and making sure that we increase operational efficiency. We not only focused on that, but working across the organization so we can make sure we're integrated. You know, we're Air Force, Army, Marines, Coast Guard. We want to be able to be on the same page. So if I deploy and I'm Air Force retired colonel, I'm able to go and help those people in the Army, and I'm able to say, I understand your system, and I'm able to move along the pace just like they are. It all goes back to training, we know that, but we're getting there. We have a joint readiness training platform that's in the DoD, and I'm glad to see that we've evolved into that.
Right, because if you're looking at a broken limb for something or some kind of an injury or an illness, then really all medicine is purple at that point.
Correct. We're all joined. So the same procedure, it may not be the same for that specific service, but we train right alongside with them. And that's great because if it's a great picture when you see an Air Force doctor, an Army nurse, and you have Air Force technicians all in the same location working on that patient to save patient lives.
And then there's also the effect, the positive effect on the staff itself, because say something is happening that is localized, that could overwhelm the staff, or it's just a busy and they get burnout and so on. It seems like this idea of virtualizing it could load balance for the staff standpoint.
Yes.
And then you've got a better work-life balance for the people delivering the care.
No, absolutely. So what we're working on is building those virtual dashboards that as soon as we have the data at our fingertips that's in this real live data module, we're able to have that data at the fingertips of each commander so they know how well their people are doing and how they can help their people to receive the care that they need to get them back up and running at the deployed environment. A long time ago, it was when you got hurt, you got sent back to the United States, to the next echelon of care and back to the United States. Now we bring the care back to you. And the idea is for you to stay and make sure that we have the prolonged health care for our patients that this nation deserves as we defeat our adversaries. And
I want to get back to the item you mentioned several times, and that's artificial intelligence. That's kind of a broad word.
It is.
What is the meaning, what's the importance of it in the medical context, in the medical care delivery context?
So there's a couple of things that we can do using artificial intelligence. We can use predictive analytics. And we can insert algorithms that can be able to predict how something is going to go for a patient. We're able to use AI chat boxes to care now at your home is now 24/7. It's not where you have to wake up from 8 to 4. It's remote, doing those real-time consultations and also doing AI clinical decision support systems. So if I get a call from a patient, I'm able to use those clinical decision support systems using AI to make faster, quicker, so I'm on to the next patient. Whereas before it would take, I don't know, maybe 30 minutes to an hour to move a patient along.
Mm-hmm. And I imagine too that that chat box or the chat algorithm, whether it's a large language model or actually more effectively in this case a small language model, could be tailored to get back to that idea of individualized medicine to that person's own record, what's happened to them. So if they have a call in the night or they don't know about a medicine or something, the chat could be trained on that individual and not on the history of medicine in treating that condition.
That is correct. And the use of AI could also filter that information back into that digital health information management tool to be able to ensure that that gets back into the medical record. So wherever you're at, you really have the medical record at the fingertips anywhere you go. You don't have to be in a hospital or in a clinic to be able to retrieve that. You can actually pull it yourself through a patient portal and be able to go where you need to go remotely.
And I'm assuming these portals are mobile enabled.
They are, yes. And what's good is that sometimes people don't have a laptop, sometimes people have their phones. So we're able to, as long as you have some sort of electronic tool, we can actually get that on your tool and be able to bring it up to retrieve your information.
All right, in about the 30, 45 seconds we have left, this all adds up to, is this what we mean by clinical efficiency?
Yes. Using artificial intelligence, providers can see the patient and not have to input stuff into the medical record. They're able to use those automated transcription to be able to put that information using real time into the medical record, so they don't have to see patients throughout the day and they don't have to wait to insert that information at night. The one thing I want to say about Maximus is our company is using AI and machine learning to drive down costs, increase readiness, and optimize personal performance. That drives along what the military is trying to do. That clinical decision support system is going to be very critical, and also to make accurately informed decisions and to be able to move the patient in and out as fast as we can.
So if military care delivery has a tooth and a tail, you're enlarging the tooth and automating the tail.
That is correct. I love that analogy because that's exactly where we need to go. It's just making sure that it's right for our patients and just making sure they're comfortable. It's a huge cultural shift, but at the same time, it's where we need to go. I think drawing the line in the sand and making it possible for our patients to view real-time live information on their medical history, that will also allow folks to live longer because they're able to see what they normally couldn't see and have it at their fingertips to have a healthier outcome.
Thanks so much for some great insight.
You're very welcome, Tom. Thank you very much for having me here.
My guest today has been Dr. Jennifer Garrison. She's a senior consultant at Maximus. I'm Federal Drive host Tom Temin. You're listening to Federal News Network. For more on this discussion, please visit federalnewsnetwork.com and search Maximus.